দর্শক মণ্ডলী, আমি আজকে আমাদের স্পেশাল নিউট্রিশন পলিসি ডায়ালগ শুরু করছি। আমাদের সাথে আজকে রয়েছেন আমাদের অতি প্রিয়জন, বাংলাদেশের অতি প্রিয়জন ডাক্তার জেমস লেভিনসন। লেভিনসন বাংলাদেশে কাজ করেন আমাদের স্বাধীনতার পর থেকেই। সে এখন বর্তমানে ফ্যাকাল্টি মেম্বার হিসেবে ফ্রিডম্যান স্কুল অফ নিউট্রিশন টাফটস ইউনিভার্সিটিতে, বোস্টন ইউনিভার্সিটিতে উনি কাজ করেছেন, এবং ইউনিভার্সিটি অফ ম্যাসাচুসেটস স্কুল অফ পাবলিক হেলথ এবং হেলথ সায়েন্সে উনি কাজ করছেন। আর্লিয়ার সে আপনার ডিরেক্টর অফ ইন্টারন্যাশনাল ফুড এন্ড নিউট্রিশন সেন্টার এট টাফটস ইউনিভার্সিটিতে এবং ইন্টারন্যাশনাল নিউট্রিশন প্ল্যানিং প্রোগ্রাম এট এমআইটিতে, দ্য অফিস অফ নিউট্রিশন ইউএসএইডে ওয়াশিংটন ডিসিতে উনি কাজ করেছেন। এছাড়াও উনি টিচিং এর সাথে জড়িত ছিলেন। উনি অ্যাক্টিভলি ইনভলভ ছিলেন রিসার্চের সাথে এন্ড কনসাল্টিং অ্যাক্টিভিটিস ওয়ার্ল্ড ব্যাংকের, ইউনিসেফের মাইক্রোনিউট্রিশন ইনিশিয়েটিভ, ইউএসএইড, সেভ দ্য চিলড্রেন, গ্লোবাল অ্যালায়েন্স ফর ইমপ্রুভ নিউট্রিশন গেইনের সাথে, and which he served as a chair of the independent review panel. Uni Aro, he worked closely with the World Bank, assisted Bangladesh Integrated Nutrition Project since its inception in the mid-90s. With the Integrated Child Development Service Program in India, উনি কাজ করেছেন, এবং সিমিলার প্রোগ্রাম উনি সাউথার্ন এবং ইস্টার্ন আফ্রিকাতেও কাজ করেছেন। লেভিনসন অলসো স্পিরিচুয়াল লিডার হিসেবে কাজ করেন। উনি জুইস কমিউনিটিতে উনি কাজ করে থাকেন এবং নিউ ইংল্যান্ডের সাথে 24 ইয়ার যাবত উনি কাজ করছেন। তার রিসার্চ ইন্টারেস্টটা হলো আপনার মনিটরিং এন্ড ইভ্যালুয়েশন সিস্টেম ফর দ্য নিউট্রিশন প্রজেক্ট ইন ডেভেলপিং কান্ট্রিজ, স্টাডিজ অন দ্য ইফেক্টিভ অফ নিউট্রিশন ইন্টারভেনশন অ্যাড্রেসিং দ্য চাইল্ড গ্রোথ, pregnancy outcome, adolescent girls, studies also on the effective of income generating activities on household food security and nutritional status. We are going to start. Before I start, Jim, can you just share your experience in Bangladesh, so people can understand your interest in Bangladesh, your contribution in Bangladesh nutrition sector?
My first visit to Bangladesh was in 1975, and I lived in Bangladesh from about 76, 77 until about 79, and then came back regularly in the 90s, and even after the turn of the new century, some years working with nutrition projects. I'll speak about some of that a little later. I feel very close in my heart to Bangladesh. And let me say, Kemenachen, Shamim Bai, Kemenachen, Tasbir Bai, Nazrul Bai, Shireen Appa, Dina Appa, and all the rest of you. And I hope all of your families are safe and sound.
Yep. Let's start about the question. What is your general observation about the condition of nutrition in developing countries around the world during COVID-19? You know that COVID is a major concern at this moment worldwide, and developing countries, including Bangladesh, also facing a huge problem for managing the COVID situation. And in our country, the number of cases are increasing day by day, but we think that due to the social distancing and other economical perspective, it could be a big problem for Bangladesh in terms of nutrition. And recently, Bangladesh National Nutrition Council also developed a projection about the nutrition in Bangladesh, and they projected that Bangladesh maybe go backward at the level of 2014 or 2011. What is your understanding about the nutrition impact in the developing countries?
Yeah, I find it all very tragic. And I'm glad to hear that Bangladesh is taking these steps. Of course, these steps keep many people safe, but they also have consequences. Shamim, let me try first and provide a little bit of perspective on this question of what's been happening to nutrition. This might be a surprise to many people, but malnutrition in the world has been reduced significantly over recent decades. we used to say that about 1/6 of the world was well-nourished and 5/6 were malnourished. More recently, and up to about 2016, it would have been possible to say maybe that 1/6 of the world is well-nourished, 2/3 of the world is getting along, and 1/6 of the world is malnourished. But to our dismay, beginning in about 2016, these improvements halted, and in some cases, hunger and malnutrition actually began getting worse. The reasons usually given for this are increased conflict in the world and also climate change. Now, as your question implies, nutrition in many of these countries is deteriorating still further because of COVID-19. This, as it isn't difficult to imagine, is because of the pandemic's effects in increasing unemployment and in turn poverty, also a reduction in essential health-related interventions, and also because of limited access to appropriate nutritious foods. Oxfam made a prediction that 500 million people could be pushed into poverty as a result of COVID-19. And the World Bank estimates that an additional 40 to 60 million people could be pushed into extreme poverty. Finally, I saw that in Bangladesh, a BRAC survey found that because of COVID-19, there has already been a 60% increase in extreme poverty across the country, and that as many as 14% of households have no food in their homes at all. Before the pandemic, these same families may have earned an average monthly income of about 14,600 taka, and today they're earning only about a quarter of that.
Okay. Now, specifically, if I want to know about the effect of this COVID-19 on the food system, what is your perception? What will be the effect, or what already happened in developing countries on the food system?
Well, first of all, food production levels in many countries are falling. Secondly, as we know, most of the food consumed in Africa and Asia today is now dependent on markets. With these COVID-19 restrictions and precautions, however, these markets, both in the rural and the urban areas, are functioning at only a small fraction of normal volume. Thirdly, of course, very important are the effects of unemployment and reduced income on purchasing power, perhaps most particularly for daily wage laborers. And then there are, of course, the higher food prices and the fear of shortages, as everywhere else, sometimes causes hoarding.
Okay. Do you like to add any other things regarding the food system or the COVID-19 effect?
Well, let me say a little bit about my understanding of how it's affecting Bangladesh. We hear lots of sad stories, for example, about producers letting their crops rot in the fields, maybe pouring out fresh milk because they have nowhere to store it, or they sell their goods at drastically reduced prices. And in Bangladesh, the number of customers who are present in markets is estimated to have dropped by about a third. I wonder if that's also your perception. People who might once have visited the market every day maybe now go once a week. Older people who may have wanted to go in a rickshaw now have trouble finding a rickshaw. Similarly, surveys in Dhaka and Mymensingh have found that the diversity of fresh produce, by that I mean fish, fruits, and vegetables that are available in the market, has decreased significantly. In Mymensingh, there's been a particularly sharp drop in fresh fruit supply, and particularly lemons. Lemons are grown in the southern parts of the country. It's hard to get them up there. And interestingly, while the total food intake of the poor has decreased in the country, there's some evidence, tell me if you think this is accurate, Shamim Bai. There's some evidence that among the middle class in Bangladesh, the consumption of primary staples, meaning rice and potatoes and pulses, may actually have been increasing while the consumption of these fresh products, fish, fruit, and vegetables has fallen. Does that ring true?
Yeah. My point is, if you know that when COVID-19 came up, we found that different food price in the rural areas was decreased. Like, there was leftover of eggs, milk. Farmers could not able to sell that products, and the price was really low in the rural areas due to the transportation problem and others. But in urban areas, I found in the market, the price of different fresh food price also very low. But now the price again increased, which is sometimes we found that is not possible for the poor people to purchase. So my point is, what is your understanding the effect of COVID-19 on the delivery of health and nutrition around the world, as well as transportation system for food products from rural areas to the urban areas? Is the scenario the same as it was in Bangladesh?
Let me say a word first about, based on my most recent study in Bangladesh. In the old days, remember, we used to assume that if you lived in rural areas and you were landless, you may as well give up. You may as well just try to make it to an urban slum, and maybe that's the best you can do. And some years ago, when I was in Bangladesh looking at this, I was very impressed with some of what landless families have done in rural areas. Some of them, if they're lucky enough to have a fish pond, have been using that. Lots have been using homestead land for gardens, and good gardens. And if you didn't have a pond or enough homestead land, you might just get yourself a bicycle and hook it up to a cart and go and buy products from the neighbors, and then go bicycle out to the market and sell them, and then buy in the market things that your neighbors don't have, and bicycle back and sell these to your neighbors, and then you do end up doing pretty well. And I would hate to see that kind of system disrupted. Let me say something about the health services worldwide. It's clear that the routine health services for women and children has suffered tremendously. Health facilities, which, as we know, were already overburdened, are now substantially weakened. And with restricted travel, families are having more difficulty getting to these health centers. Community-based health services have also been interrupted, and data from some district health services in some countries have found a dramatic drop in the provision of antenatal care services. This is heartbreaking, absolutely heartbreaking. Meanwhile, the UN Population Fund has projected that reduced access to family planning services and the enforced confinement of families is likely to lead to millions of unintended births in poorer countries. and the disruptions to maternal care and nutrition could also lead, it's not difficult to imagine, to sharp increases, for example, in adverse fetal outcomes in preterm babies and low birth weights and the rest. I also worry a lot about water and sanitation and hygiene services falling behind and receiving lower government priority, which would mean, of course, serious increases in infectious disease outbreaks.
But as you said that, if you look at that young people, like, school-going children, they are not allowed to go to the school, and poor children, some of the, in Bangladesh, high price, like, private schools, they have started the online classes. Even in our whole education system, they are not, taking any classes due to the access of the internet may not be possible for the sports system. So universities are closed at this moment. Some of them private universities, they started the education. So what is your understanding? What is the effect of this COVID-19 on the education system?
Yes. In the United States, a lot of families are fortunate that the kids can keep up with classwork on the internet, and of course, in poorer parts of poorer countries, that's just not possible. In terms of overall educational effects, we know that, as you mentioned, a lot of schools and specialized training institutions have closed down because of COVID. So sadly, what we are likely to see is a further disadvantage, particularly for female students who still suffer from higher rates of illiteracy, and health and nutrition education in schools, which is a big plus, has been proving so valuable, is now going to be placed on hold.
Do you think that, in terms of this education system is collapsed, is there any effect of the nutrition for the children as well as for the adolescent?
Absolutely. The children are going to suffer. The adolescent girls, my goodness. I learned about the importance of adolescent girls in Bangladesh. I will never forget going out into villages and seeing these adolescent girls. What a powerhouse. Absolutely amazing. If I went to some villages where if any family was keeping the daughter home, the daughter under age 18 home, or out of school, these young adolescents would raise heck. I mean, they would really go to town. And goodness, if there was any report of spousal abuse in the house, once again, these adolescent girls are on the march and threatening legal action. I love to see that. I absolutely love to see it. Adolescents, yes. Kids, yes. Mothers, yes. And if malnutrition gets worse among the moms, that means automatically it gets worse among the kids.
Jim, I just wanted to share one information that, in Bangladesh, when COVID came, we had a lots of, management problem. And the first we found that garments factories, they opened it for, operating their business. And people just, against of this decision. However, then governments, association, they stopped again. After that, when situation little bit more, time passed, then they started again the garment factory. But we found that the effect affected number of COVID-19 in garments worker is really minimum. On the other hand, we also found in the slums areas, poor people, those are affected. They are not, really poor people too much affected. Slum areas people are not affected. So in terms of the mortality, you know that Bangladesh still very low mortality on the basis of we expected. It is minimum number people has died. So there are lots of discussion is going on that what is the reason, and lots of people say that maybe this is a immunological perspective, maybe our demographic dividend. We are getting the positive outcome because young people are more in Bangladesh. But lots of people also saying that we need to like take vitamin C, zinc and other for saving your life from the COVID-19. What is your understanding regarding this nutritional micronutrient status and the COVID-19 outcome? Do you have any perspective about this thing?
Yeah, I couldn't agree more. I think this is a time to just, where people have the opportunity to stay as healthy and well nourished as possible, and that means micronutrients as well. All of these that you mentioned are really important. At the same time, trying to get a balanced diet. This seems to be a problem. It's always been a bit of a challenge in Bangladesh. We used to say, people used to say, maybe still say, that if you haven't taken rice, you haven't eaten a meal. And that has changed a bit among some groups, but still it's pretty powerful, and it does not make for well-balanced, nutrient-rich diet. So that's certainly a concern.
Yeah, well, we had earlier we had a webinar with Professor Ted Grainer. You know him. Ted also has he also the same perspective, and he also discussed different issues of the nutrition. And I hope that Ted is seeing our program, and he just knocked me and he said hello to you. So I think that perspective of nutrition is very important for the COVID-19. So now I'd like to know from you, as you have a very in-depth understanding about the Bangladesh and nutrition project. You did lots of work in Bangladesh. What do you think the most sensible action government and international agencies, assistance agencies can take during this COVID-19 in developing countries, and specifically in Bangladesh?
Let me say first, Shamimbai, that Ted Greiner is also very dear to my heart, a long time, wonderful friends. We actually were classmates together. We actually were both students of Michael Latham, whose name I know you know very well. And I have followed Ted through his work in Africa and Korea and Brazil. He has done wondrous service in the world. In terms of what the governments and international agencies can do, let me start by saying that while these mandates are so important, as I've mentioned, they certainly have consequences. But some countries are beginning to take actions which could reduce the effect of COVID on nutritional well-being. We've already talked about some of these. In the food security area, it would seem that the immediate priority has to be the provision of emergency food to households and individuals who are most vulnerable. If ever there's a time to hone in on vulnerable households and more generally vulnerable geographic areas, this is the time. But who knows, this could be a time, sometimes out of crises comes structural change. It certainly happened in my country after the Great Depression. It could be time to consider some structural agrarian reforms and prioritize more efficient agricultural practices. it's possible that that it is a time for some important structural changes to take place. In terms of social protection, this is surely the time to provide or improve social safety net programs, including cash support for the most marginalized and vulnerable households and individuals. I saw an evaluation, maybe you've seen it, Shamim, of a conditional cash transfer program in Bangladesh that found that the combination of cash, nutrition education, and growth monitoring motivated mothers to significantly improve the diets of their children. In the health arena, it would seem that priority ought to go to effective community-based services, again, in the most vulnerable geographic areas. We now know that it's possible. We learned this in BINUP. We know it's possible to deliver at the community level all sorts of things that normally you think you have to go to the health center for. Immunizations, nutritional supplements, health and nutrition education, reproductive, maternal and newborn care, antenatal care at the community level. These services can also provide therapeutic treatment for severely malnourished children. And of course, all of this is on top of essential communication about COVID itself. Finally, in terms of health stuff, it would seem the better part of wisdom, let's think about this, Shamim, better part of wisdom to provide remuneration to these community health workers at this time, rather than relying on volunteerism. In terms of education, with the formal educational institutions closed, this would be the time to mobilize informal institutions, mothers groups, women's groups, community support groups, to help deliver both health education and general education and counseling. In terms of the environment, I would think top priority has to be to ensure safe water access, and also actively promoting hand washing and safe hygiene practices and community-led sanitation. Also a time to try and continue the infrastructure work of building the wells and community pipes and latrines. We can't let that stop because of COVID. WHO recommends that for individuals, let's drink enough water. Let's also eat fish and unprocessed foods where possible, and reduce salt and sugar intake. You want to hear something interesting, Shamim Bhai? I was always interested in seeing that in Bangladesh there is less severe anemia than there is in India. And the reason for it is fish consumption, even the little fish that show up in the streams and the irrigation canals. That is jadoo.
But Jim, as you said that there's a need of cash transfer for the most vulnerable group of people. As you said that we need to community level intervention to overcome this problem, especially these nutrition related activities. But my point is, if you look at that, COVID-19 pandemic status, we still don't know that how long it is going to stay in global. So as a country like Bangladesh, the government, they have a limited resource, So like our government also given cash to the most vulnerable people, like they given 50 lakhs, 5 million people cash through their mobile phone for access the food and having the food during this COVID-19. But that was given by one time, and that was a huge amount of money for the government. But we appreciate the government did this thing. But if it is continued, then the point is there is a limited resources. Then how developed countries or donors can they support in this sector? Second point, the community-based intervention, as there is a stigma among the people having infection from others, it may not be possible at this moment to provide a community-based service, door-to-door visit and other services. So, what is the solution? How long do you think that government should provide this cash transfer? And the donors, how they will act, as well as community-based intervention, how we can manage it.
Cash transfers are a wonderful thing. There's so much good data to support it. I wish that international assistance agencies, and let me start with my own country. One of the things that upsets me most about the government in my own country is how it has been ignoring the problems in so many countries. I think it's tragic, absolutely tragic, and totally wrong. In terms of community health services and the danger, maybe Eminence can start producing thousands and thousands of masks and get those around to the health workers. I don't know. My best hope is that vaccine will come along quickly and put an end to all of this trouble.
Yeah, we feel that there are lots of NGOs is working in Bangladesh. Like we have a very big NGOs like BRAC. There is a number of NGOs organization like PKSF Polli Karma Samsthan Foundation. There is another network from the government like Bangladesh NGO Foundation. They have a huge number of NGOs working with them. I think that it's possible to engage this NGO and civil society to support government for the community-based services. But still, there is a gap. Still there is a coordination gap to engage this civil society organization, and we feel that government will take support and engage the civil society in upcoming days, because this is a problem of whole countries and everybody, all the stakeholders should engage. So what do you think that, how donors can support civil society to engage at the community level? What is your answer?
Let me mention, Shamimba, I think we may have talked about this in the past. But one of my favorite stories in all of international development is the story of Peru. So here we are in about 2006 or so, and a survey is done that shows that economic growth has been improving and nutritional status hasn't improved at all. Not at all. Terrible thing. So what happens? Civil society organizations like Eminence begin working, and they form a larger organization and they go to work. It is one of the most beautiful stories I ever heard. The first thing they did was there was a presidential election that year. There were 10 presidential candidates. This civil society coalition went to every single one of those candidates and made them sign a pledge that if elected, they would agree to the 5x5x5 program, which means reduction of stunting in children under 5 in 5 years by 5 percentage points. Every one of the 10 signed it. There was just too much pressure. And then the person who was elected took a look at it after election and said, I think we can do better than that, and increase the target from 5%, 5 percentage points to 9 percentage points, and they succeeded in reaching it. Absolutely terrific story. And they have continued to put pressure on to make sure that government financial allocations are enough, to make sure even that at the local levels, there is adequate adherence and initiative. I am just so impressed. And when I think of Eminence, I think there is the promise to do something like that in Bangladesh.
Yeah, thank you. Jim, as you have been working in Bangladesh, you have a very good understanding about the different stakeholders in Bangladesh. Those are working for the nutrition, like WFP, WHO, UNICEF, then Save the Children, HKI, SCF, FAO. They have been working a lot. USA, DFID, they are also investing a lot. European Union also doing lots for nutrition. They are also doing lots of work for nutrition. Can you just share your experience? Because last 12 years, we are doing slowly, but we are doing good for nutrition. Those we are lots of behind our expectation. What is your experience about the different stakeholders? How did you see them? How they did work for nutrition in Bangladesh?
Well, let me say first, Shamim Bai, that I've been very pleased to see during this crisis that the government, with the help of some of these assistance agencies, has been stepping up food assistance to vulnerable populations, usually the non-perishable items that we talked about, rice and potatoes and oil. I've seen an estimate that the government has subsidized food for about 50 million people in the country, and that about 5 million poor households have received something like 2,500 taka through what you talked about, mobile banking, through the mobile banking. The government has also prioritized rice procurement to assure staple food security. And the Bangladesh Agricultural Development Corporation has been purchasing rice from farmers at higher prices as a form of support. In Noakhali, that assistance has been extended to include fish. 10,000 families in Noakhali have been receiving supplies of fish along with rice and potatoes. And sometimes, I'm sure you know about this, some wealthier individuals in areas have been providing food assistance. However, clearly relief has not been sufficient for everyone. And you've probably seen, I've heard stories about an increase in the number of beggars in Dhaka. Let me say a few words about the gradual evolution of nutrition in Bangladesh as I see it. Does that make sense? First, let me say how pleased I have been to see the reduction in malnutrition overall in the country, with the proportion of children under the age of 5 who are moderately or severely malnourished dropping from 55% in 1997 to 41% in 2011 to 36% in 2014 and down to 28% last year. Absolutely wonderful. Of course, we know that this progress has been uneven across geographic areas, Khulna and Rangpur doing a lot better than Sylhet. And as I mentioned, dietary diversity is still a big problem. When I first came to Bangladesh in the mid-1970s, there were no nutrition activities underway in the country, but there was growing interest. I don't know if Professor Rezul Karim is on this call, but I had the good fortune of being able to work with him at the time when he was a young professor at the Institute of Nutrition and Food Science at Dhaka University. We often referred to ourselves jokingly as the Young Turks. And we did some very interesting work together. We spent lots of time in villages weighing young children, plotting their growth curves, together with the children's mothers on growth charts, and talking about this with the mothers, asking lots of questions, providing some counseling as best we could. We all also interacted very closely with BRAC, which was beginning to lay the groundwork for some of its major programs that it subsequently developed. And then I had the opportunity to become actively involved in launching the Bangladesh Integrated Nutrition Project, BINUP, in the 1990s. Here's one sad bit of history that I don't know if you know about this, Shamim Bai. namely that two major assistance agencies actually tried to sabotage that program. One of them was FAO, has since hopefully come around on this issue in a big way, but FAO argued that nutrition projects should only be about food and that BNEF's scope was much too broad. The other, you'll probably be shocked, was USAID. And USAID on the grounds that the priority had to be population control. We're talking 1990s. Population control had to be the priorities. And if nutrition and public health workers were distracted by public health activities, that would be very bad, because what they should be doing is promoting condoms and IUDs. Eventually, BNEF was launched, and the data from that project was pretty impressive. This led to the National Nutrition Program, which unfortunately became pretty political and was less effective, but did introduce the push diapos that you know about. I should mention that while being involved with BNEF, I had the opportunity to work with some absolutely remarkable people, including Iqbal Kabir and Zeba Mahmood and Delwar Hussain, and there were more. All Bangladeshis should take a moment sometime to learn about Iqbal Kabir. He's a national hero. The most unfortunate development in this evolution of nutrition in the country, to my mind, was the so-called mainstreaming of nutrition in Bangladesh, putting an end to nutrition projects per se, weakening the delivery of nutrition services at the community level, and seeking to incorporate nutrition into other public health initiatives. This move, sadly the result of pressure from the World Bank, led to the creation of the National Nutrition Service, which has had very mixed results. Happily, there have been at the same time some very positive effects of what we call nutrition-sensitive interventions, activities based in sectors other than nutrition, agriculture, education, WASH, social protection. Economic growth and reductions in poverty and increases in household income have been strongly associated with reductions in malnutrition in the country. Also, of course, the attention given to maternal education and delaying the age of marriage, wow. And also delaying first pregnancies, and as we talked about, empowering the contribution of girls. Another huge factor has been the reduction of open defecation and improved water supply. The percentage of the population with improved access to water sources increased from 68% to 87% between 1990 and 2015, and the practice of open defecation fell from 40% to 2% during this time. And let me just add parenthetically, you can think about this, that in India, the prevalence of open defecation is much lower in Muslim parts of the country. We also have to give credit, of course, to the vibrant NGO sector, which of course includes Eminence, supporting income generation and delivering basic services and everything else we've talked about.
Okay, Jim, but still, I have an observation, like, if you look at this COVID-19, we found that mostly it is affected in the urban areas first. Now it is spreading to the, other part of the different part of the countries, and it is going to the rural areas too. So if you consider this disease, maybe that urban areas, but urban related health problem, those it is an infection disease. but in terms of the health service, like, there is a big gap in Bangladesh in the urban areas. So I'm just thinking that how nutrition will be, cope up, and the system will work for improving the nutrition status, as there is no structure for nutrition service in urban areas. However, there is a new initiative taken by the FAO and other development agencies, and in Bangladesh, this become a very popular. That is, rooftop agriculture. And you may know that there is a guy in Bangladesh, is a celebrity called Shaikh Shiraz. He has been doing and promoting this rooftop garden for a long time. It is now his one of the major agenda for popularizing this rooftop garden. What do you think about this, rooftop gardening issues in urban areas? Do you think that there is a future for rooftop gardening?
Absolutely, absolutely terrific. I think the idea of ownership and who's responsible and who has to take care of the gardens has always been an issue in urban areas, but I think it's absolutely great. And I have to say, when I think of successes, national successes in gardening overall in countries, I think first of Bangladesh. Absolutely great stories about gardens, which not only have, it's interesting, they have not only been feeding their own families, and because their fruits and vegetables increasing micronutrient intake, but also these produce from these gardens have been sold on the markets, giving more income to these households, which have been able to buy more rice. And the result is that caloric intake of these families has also increased.
Okay. So another point I like to share with you, during this COVID-19, we found that there's a huge disruption of the health services as well as nutrition services in rural areas and urban areas. Still, like, the system is not prepared to provide the services at the rural areas. So we feel that there is a big problem for, pregnant women, regarding, engage them, taking the antenatal care, nutrition, food, then delivery system. Most of the delivery at this moment is going to happen in the household level. People are not coming for delivery at the facilities, because facilities are not also providing these services full swing. And other things, we found that there is a big problem for breastfeeding counseling and complementary feeding counseling. In that perspective, we feel that there is a big investment is needed for the communication, like, our people giving the messages, digital health service, nutrition services, and other things. That can be a solution. Eventually, like, that, in Bangladesh, there is no nutrition care services at the rural level. Recently, government, started a project called multi-volunteer, health service, multi-purpose health volunteer MHB services. It is now piloting in 30 upazilas, who will provide this, community level engagement for the nutrition and other 22 services of the primary health level. So what do you think that, investment in the communication as well as digital and health services for the nutrition, do you think that there is a scope for these services, digitalization, and investment more in the communication?
I've been so impressed, I mean, by what has the advances that have been made in rural services by community health workers with these little phones that are so wonderfully programmed. I learned something about those. My son, I think I may have mentioned, and his wife run a wonderful program in the slums of Kolkata called Calcutta Kids. And those community workers have these phones which help them do everything. I mean, if a woman is a little bit late on an antenatal care, it lights up and you got to go to that home and take care of it. If a kid is a little bit behind on immunizations, wham, it lights up and you got to go to that household. I've been very, very impressed and impressed with the effects of communications in general on these households. Antenatal care, my goodness, I think one of the great benefits of BINUP had been increase in the percentage of women who got 3 or 4 antenatal care visits. Back to communications for a moment. I heard a story, do you know about this? Where one international organization bought advertisements on Bangladeshi television during the World Cup. Nutrition communications messages. And this was then evaluated and found that people really heard them and in many cases were abiding by these messages. I think that's wonderful. Finally, in rural areas, one of my worries, as in many countries, is what happens if you get COVID? What kind of services are available? Are there ventilators in rural health facilities? I'm just not sure about that, and I would worry about that.
Okay, Jim, we know that you wrote such an interesting book, Tales from the Field, and I found that in that book, you shared lots of stories of your field experience. And I know that, you wrote lots of things about Jeba's experience. I just say thank you to Jeba Mahmood, due to the, she helped me to connect with you again, and she encouraged me to bring you in this program. So I'd like to thank you, Jeba, to support us, and she encouraged us to, she always, love us, and you know that Jeba really, respect you in every aspect. So can you just share some stories from your book, Tales from the Field?
Let me tell you.
With us. Hello, Andrew.
Let me tell you a story about this guy that just whose picture I'm just seeing, Andrew Jenkins. Oh my goodness! Sometimes these expatriates can do some remarkable things. I don't even think of Andrew Jenkins as an expatriate. I think of him as a Bangladeshi. He has done extraordinary work. He is just a phenomenal, fascinating human being, and I have absolutely loved interacting with him and working with him. Let me tell you a story. Andrew knows this story well, that I will never forget. It's a kind of funny story. Shortly after Louise and I arrived in Dhaka, we're now talking mid-70s, there was a welcoming reception given for us by the Institute of Nutrition and Food Science at Dhaka University. And the high point of this reception was the entertainment provided to us by a group of young people, a group of singers calling themselves Udichi. You know about Udichi, Rising Up.
Udichi, yeah.
So these were all young people. Your son Shamimba would be interested in this. All young people, all politically progressive. We loved this group. And before the reception was over, Louise and I had made a plan with Udichi that we would meet together once a week, during which time they would teach us Rabindra Sangeet, and we would teach them to sing their Bangla songs in 2-part, 3-part, 4-part harmony. And so we did that for several months, and it was absolutely delightful. Louise is going to try to sneak past me, but let me just show you Louise because we're talking about her. Say Kemina Chen.
Kemina Chen. Hi, Andrew.
Hi. How are you?
The better for seeing you.
So,
Yeah.
so we did that. We met every week for several months. It was absolutely delightful. Then one Tuesday afternoon, Louise and I showed up at the site as usual, and no one was there. And we came again the following Tuesday, and again, nobody was there. We didn't have a clue. It was so strange. Months later, I ran into a member of that group on the street. At first, he tried to cross the street and avoid me, but I grabbed him, pakaro, and I asked him what happened. Well, after a long pause, he finally told me, he said, the group had many meetings about you. And we concluded that if you worked for the US government and you were speaking Bangla, and you were not living with other expatriates in Gulshan, but you were living with Bangladeshis, and you were interested in us, a politically progressive organization, you had to be CIA. We later discovered that for the same reason, more than a few US aid and embassy staff believed the same thing. And we also learned that we had been investigated twice by the Bangladeshi CID.
Okay. Thank you. Thank you for sharing this, your story about Bangladeshi young people. Udiji still work, they do good job in our country. They always raise voice about the humanity. So can you just, share with your thoughts, what will be the major threats for humanity is going to face in the near future? As we saw that lots of bad things happen during this COVID-19. What is your understanding? What is the threat for the humanity?
Well, I have to say that whenever the discussion turns to global warming and climate change, I think first and worry most about Bangladesh, and my heart breaks. Bangladesh is one of the most vulnerable countries on earth when it comes to climate change. Some 10 million Bangladeshis have already been displaced by global warming, and it's only getting worse. Additionally, there's no question that climate change will have a disastrous effect on agricultural production in the country. That's already starting to happen. I've been pleased to see the establishment of the Bangladesh Climate Change Trust Fund and the Bangladesh Climate Change Resilience Fund, but a whole lot more needs to be done. And of course, not only in Bangladesh. If I were a young Bangladeshi today, I would be out there protesting everywhere, not just in Dhaka, but at the UN, at outposts of the fossil fuel industry, and if it were possible, at the White House. The US is such a major culprit, it's just heartbreaking.
Okay. Jim, when I saw Andrew, I cannot control myself, to request him to share his experience about Bangladesh as well as his feelings. What is going to happen regarding the nutrition in developing countries? Andrew, can you just share some points?
I've always been optimistic. I continue to be optimistic about Bangladesh. If there are people in Bangladesh with the commitment that you folks at Eminence have, that the folks at BRAC have, only good things can come of that, and I will have to be optimistic. Let me share, if I may, a couple of final thoughts. I mentioned a little while ago that my son received his Master of Public Health degree from the Brack University School of Public Health. And he is married to a Bengali. And together they operate this maternal child health program called Calcutta Kids with a C in the slums of Kolkata with a K. And their son, my grandson, speaks 2 languages. Can you guess what they are? English and Bangla. There he is. His name is Zubin. I also have to say that at my home in Vermont, I have a heroes wall. I've told Andrew about this. And on that wall is a photograph of Rabindranath Tagore. In this photo, he is together with Helen Keller, who was a deaf-blind American author and activist. So Tagore has always been one of my heroes. And so I can't leave you today, Shamim Bai, without just a bit of Rabindra Sangeet that we learned from Udichi. Are you ready? Korubayu boy bege chare dik chai mege ogone nao koni baio. Korubayu boy bege chare dik chai mege ogone nao koni baio. Tumi koshe daro hal, ami tule bamet pal. Tumi koshe daro hal, ami tule bamet pal. Ay maro maro tan, hi-yo, hi-yo, hi-yo. Korubayu boy bege chare dik, chai mege ogonai now, koni bayo. Abar deko hobe bondu. Khuda Hafiz, everybody.
Thank you. Kantu, before I finish, Jim, I just want to request Andrew to share his experience, in Bangladesh and what is his feelings about the nutrition effect of COVID. If you permit, can you just share with us your understanding and your experience in Bangladesh?
Yes, okay. Well, I agree very much with Jim about climate change. In fact, I'm right in the middle of installing a heat pump in my house in England. I've just removed the oil-fired heating system. So by next week, we will not be burning any more fossil fuel to heat our house. And I think that's extremely important. So I agree with Jim about that. I think the other 2 really big issues facing the world are poverty reduction and nuclear weapons. And I think nuclear weapons are an even bigger threat than climate change. Very important. About poverty, obviously, the current situation and the current shock is very worrying. I'm working in a project on the coast in Noakhali, and with a team of about 100 people. So far, our office is still closed in the Shonapur because Noakhali Shadar has experienced a big spike in COVID cases, and I get the results every day, and it's still about 10 times higher than the national average. So that's a really big concern. But what I want to say about Bangladesh, I'm still quite hopeful. I first came to Bangladesh with Oxfam in 1975 to work in the famine. I worked in Rangpur in Rongmari. And that was a famine in which maybe 250,000 people died of starvation. And since then, we all believed that that population would double between then and now. And it did double, but it doubled more slowly than we thought. The fertility rate was 6.6 in 1975. Now it's about 2.2, which is about the same as Britain. So things have really changed. We had a discussion in BRAC a couple of years ago about possibly setting a target of eliminating extreme ultra poverty completely. I mean, not poverty as such, but ultra poverty. And that was unthinkable at that time. And if you said that when the population doubled, food production would also double, nobody would have believed it, but actually food production tripled. So there are signs, and I also work in the coastal area where we're seeing the results of sea level rise, but there are a number of things we can do to adapt to sea level rise. So I'm not completely pessimistic, but obviously the present situation is contributing, both in terms of the COVID epidemic, the recent floods. We had a major cyclone Amphan in the coastal zone recently. So, you know, there are definitely problems. And I agree with Jim about the culpable forces who are deliberately contributing to climate change. But I still think that there have been some very positive changes that I've seen in the last 40 years, and I hope they continue.
Andrew, thank you so much, for joining with us. It encourages us, to consider and talk about more about the nutrition. We are trying to advocate with our government. We are raising our voice that there should be more investment for the nutrition. There should be innovative solution during this, COVID-19, because there is a big problem for delivering the health services as well as the nutrition services at the field level. So we are trying our best, as we are a small organization. Jim knows us, but we always try to raise our voice. We always try to do our best, activities for the nutrition in Bangladesh. Hope that by your support, and Jim always loves us. We are really grateful to him. And there is another person I should mention. I mentioned earlier, Ted also is some sort of, he always support us. We try to do our good work, but we don't know that what is the solution is upcoming. But we hope that there is a big changes coming after this COVID-19. System may be changed due to the new ways we found in the world. We found that this is a different type of pandemic situation. So we need to work in a different way. I'm hopeful that we'll continue the communication with Jim and Andrew, with you too, to do some work in the nutrition in Bangladesh. We'd like to see you again in Bangladesh. Jim, you are invited again to Eminence and in my home too. And Andrew, you may know that Jim knows. We have a small office, and in a small office we have a small seminar room, which we have given the name of Jim's mentor as well as our mentor, and we always try to recall him do the nutrition related activities in Bangladesh. Jim, can you just a little bit say about him?
Say about?
Just recall our seminars room.
Oh my goodness. Oh, what an absolutely beautiful thing. I should say, Andrew, I don't know if we ever talked about Michael Latham. He was also a Brit. He grew up in Tanzania, and he considered himself in many ways lots more African than he was European. He also did civil disobedience on behalf of anti-apartheid efforts relating to South Africa. We used to talk a lot about our time in prison. He was there for South Africa. I was there for nuclear weapons. We we used to say that you can always tell who your good friends are, because they're the people who help you move when you have to move, and those are the people who visit you in prison. So that's That's a great memory, and absolutely wonderful that you all and Ted Greiner did this dedication to Michael Latham. He was an absolutely extraordinary human being.
Yeah, thank you. Andrew, we just given the name of our small conference room by the name of Michael Latham. We feel that Eminence, though it is a small organization, but we follow his philosophy. We follow his the way he did work for the nutrition. And we always try to show our respect to Michael Latham. And I think that our respect to Michael Latham give us a scope to have a good friendship with Jim Levinson as well as Ted Greiner too. So thank you, Jim, for your encouragement all the time for us. And Andrew will keep in touch with you. I'll soon contact with you. And thank you from Eminence and from Bangladesh, as well as for the nutrition field of Bangladesh. We are grateful to you for your contribution for poor people of Bangladesh. Thank you.
Thank you very
We're
much.
going to finish up. Thank you.
Okay, thanks a lot, and I look forward to seeing you again.
Absolutely.
And love to Louise, Jim, and see you again soon.
And to Jan. Good.
Yeah. Okay.
Thank you.